views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. Welcome to BronxTalk. Back in June of 2014, we did a program with the Claremont Healthy Village Initiative that featured a stirring and at times disturbing video study of a community with significant health deficiencies brought on by poor nutrition, lack of physical activity, lack of access to healthy foods, and maybe above all, a lack of education and awareness on how to address the myriad of problems that can keep an underserved urban community chronically unhealthy. Since that time, the Claremont Healthy Village Initiative, a collaborative that features, well, about as many partners that are willing to participate, has been hard at work to provide that education and awareness, as well as activities that can turn some of the nation's most difficult health indicators around. Tonight, we check back in with the Claremont Healthy Village Initiative and give you an update. While they will agree that the work is far from over, we will also learn tonight that they are having an impact. Please join me in welcoming from the Claremont Healthy Village Initiative, a program analyst from Bronx Care Health System, used to be Bronx Lebanon, Patrick Maceo. Nice to have you. Nice to see you, Patrick.
Thank you very much. Thank you for having me.
And the Executive Director of Directions for Our Youth, that is Ramik Williams. Nice to see you again.
Nice to see you again.
Let's start with you, Patrick. When we first met and we talked about Claremont Healthy Village Initiative, what was the agenda? What was the idea? And why did you put what is now become a large effort together?
Yeah, great question. So originally the idea was to look at a few chronic illnesses, diabetes, asthma, obesity, and we originally kind of took a medical lens, but we shortly realized that it's not the medical care that's really the issue. We started to take a broader look at these types of things, and we really started to understand that health is much more important than your medical care. It has to do with your environment, it has to do with your education opportunities, your employment opportunities. And so what we realized is that, it can't just be a hospital, it can't just be a medical care provider or an insurance company. We need to, as you said, get as many partners who are willing to partner to really stand a chance at helping people become healthier and live the lives that they want to.
There are many cliches that fit right in. It takes a village, Claremont Healthy Village. I mean, it's right there. So the idea was to do a larger vision of this. And the other thing is, and I was telling some of the people up in our crew, talking about what the show was going to be about, I said, it's not about giving everybody a shot. If we could do that. And I think the trend, and you would know better than I, but the trend in healthcare is to look at healthcare a lot differently than just saying, go see the doctor and you'll take a pill for what ails you. And that's what this is about. You're
absolutely right. A lot of research is coming out that only about 10 to 20% of your health, a person's health, has to do with clinical care. So that's about 80 to 90% of your health outcomes, depending on your physical environment, your socioeconomic status, the nutrition that's available to you, some of your behavioral habits. So you're absolutely right. It's not just about getting a shot. It's not about even your checkup. It's about, can you go out to the park and walk for 20 minutes? Do you feel safe going outside?
Which would then discourage you from walking, and that becomes a health problem.
Exactly. It's all interconnected.
And we were talking before because I know you and knew you from Bronx, Lebanon, and it's now the Bronx Care Health System. That actually reflects philosophically what you're talking about.
It does. Healthcare is more than just getting care. It's more than a hospital. In fact, in the future, we want to avoid hospital care, right? You don't want to be sick enough for the inpatient. You want to be out healthy, doing annual checkups, but really focusing, if you're living healthy, then you really don't want to see your doctor.
And this is why, and we talk about interrelationships of all different things in the Bronx. This is why where is the grocery store is as big a health problem is what time is my appointment to, get my checkup or something like that. And maybe even a bigger one, because if they don't have a grocery store, they're going to need a lot of appointments. What I want to do, if you gentlemen will take a minute, I want to show a clip from, this was an original video that we showed way back 4.5 years ago. And it to me, we took out 1 minute that just illustrates exactly what the problem is. You're going to see a gentleman in there who's going to talk about the lack of access to a grocery store and the fact that he used to go into the fast food Chinese restaurant for lunch every single day, 7 days a week. So we're going to take a break. We're going to look at that. This is from the original show we did in 2014 about the Claremont Healthy Village Initiative. Take a look.
Here go the Chinese restaurant right here, across the street right there. That's why that used to be my meal every day. Every day, a half a chicken with French fries, with an iced tea. It used to be a supermarket right here on 169th, but it closed years ago, and they never put a supermarket back there. So the supermarkets is far away from where I live at. So then they go to a whole bunch of different fast food joints around here, which is McDonald's and there's a White Castle. Hey, how you doing, Pop? Could I get fish and salad, please? A piece of fish and salad? Okay, thank you.
And in that very short 1 minute video, you actually see the transition. He went from telling you that he buys, fried greasy chicken every single day to going into a deli and ordering something healthy. That's obviously what we want to do. Ramik, let's bring you into the equation here, because as we now have identified, it's all the different partners, it's all the different things that contribute to a healthy community. Talk to me about Directions for Our Youth.
Directions for Our Youth is a 27-year-old youth development organization. We started in Lower Manhattan, operating programs for disconnected youth that had high truancy rates. We've expanded to offering youth services programs, after-school programs, summer camps, leadership programs, mentoring programs, and we are now a happy partner, have been for the past 2.5 years, happy partner of the Claremont Healthy Village Initiative. We have 9 sites, 8 are here in the Bronx, 1 is in Lower Manhattan, serving about 1,200 kids a year.
Why, this is such an easy question, I could answer this question. Why was this a good neighborhood for you to say, you know what, 2.5 years ago, we really ought to be in this neighborhood?
Well, our mission is to develop local and global leaders. And so looking at the neighborhoods that we already were in, it seemed the right fit for the work that we do. We do the heavy lift. So we enter in neighborhoods where there aren't a lot of services. In this particular district, it has New York City Department of Youth and Community Development identified the highest need of basic needs services, including after-school programs, summer camp programs for parents and children. So it made sense for the organization to go into the neighborhood.
We need all those things all over the Bronx, and I've been a fierce advocate for those things because we're going to solve problems. That's how we're going to solve the problems. And this is an example of it because you're addressing, a health problem and partnering up. Yeah. Talk to me about setting up the program and custom making it for the Claremont Village.
So I came into it about 2 years ago, and the program, or at least the foundation for the initiative, had already been laid. And so what we did was take on a biking program, a fencing program, and part of a neighborhood walking program. And we developed those through the lens of youth, so that the youth were more engaged in the program. So fencing is not a sport that you would attribute to the Bronx.
For sure.
But we developed the fencing program. Neighborhood biking isn't really a program that you would attribute to the Bronx, but we developed that program as well. So we had about 15 kids every weekend traveling the Bronx, not only getting exercise that way, but also conducting community surveys. So looking at the needs of the neighborhood.
So you engage them not only in solving their own issues, or at least beginning to solve it, but then you almost empowered them to begin to, well, then we need you to help solve the whole thing.
Well, the other end of the
all
candle,
the other issues.
absolutely. The other end of the candle is that we train them on how to advocate to their public servants. So the elected officials in the neighborhood, the community board, the New York City Council people, we train them on how to really speak to the issues that they saw in their neighborhood every single day. And so that really activated their leadership. So not only were they leaders within themselves, but they also were leaders within their household to change the habits that lead to high health disparities.
Even say, hey, mom and dad, maybe we can eat a little better. Or I was somewhere today and they talked about, gee, why aren't you taking a walk with me, for example?
That's exactly right.
I got to ask you, because it's not directly related. So the kids like fencing?
The kids like fencing, absolutely.
Of course they do. I said that somewhat rhetorically. We were talking beforehand about, the ice rink coming. Bronx kids, they love activities.
Yeah.
Give them good activities.
Yeah,
Doesn't
you
matter.
give them a saber and they're happy. It's not Star Wars, but it's something
No,
close.
but it obviously it instills discipline and
Yes.
all these other things. Patrick, one of the original concepts, which I recall, because as you know, I participated in many of the dialogues originally
Yes.
when
You were a big help.
well, and we continue to.
Yes.
And whatever, this is what we all have to do. But one of the things was exactly what Ramik talked about, and that was empowering young people. And you started a leadership program. So this was really taking a look at the village, because these kids are only going to get older. And if you started with older people, well, they're going to get older, but you're still going to have that void. Talk to me about, aside from working with Ramik, the kinds of leadership programs you've built into
Yeah,
this.
absolutely. As Ramik pointed out, it starts with the youth. They're levers for change, not just instilling good behaviors there, but also they're levers to change their parents' behavior, kind of as you said. So what we did is we started the Urban Ambassadors of Hope Youth Leadership Council, which is funded by the New York Community Trust. And what that is it's actually a partnership similar to Claremont Healthy Village Initiative, going across and engaging partners, so different schools, different community centers, to supply youth with a curriculum and lessons and experiences, as well as working together. So these are youth that traditionally, and a cliche, on the other side of the tracks, the Metro North train tracks run right through Claremont. So
Cliche,
often,
literally
yeah,
and figuratively. I
yeah, the youth generally or historically maybe did not interact. So this was an opportunity to bring up and build neighborhood and community. And we've taken them on retreats. The quote that we use to kind of really lead this program is, the mind once expanded never returns to its previous dimension. So it's really an opportunity to provide experiences for those youth.
Hard or easy to recruit young people to do it? My guess is, this is my own prediction, initially it was difficult, but once one saw the other saw the next, and then they said, you know what, it's kind of cool to be okay,
Yeah, I think that's absolutely accurate.
Oh, do you have a number of people? Do you want to quote a number of young people who are involved?
I think at this point we're close to probably around 100 total. Yeah, over the past 2
Listen,
years.
I was there when we were struggling to get a dozen.
Yeah, no, you're absolutely right.
And I haven't checked in a little while. That's why we're doing this.
Yeah.
So now you got 100 young people in that. How many people? I mean, if I remember correctly, there was like about 10 or 12,000 residents in public housing in 3 public housing projects in that neighborhood.
You're absolutely right. Yeah, it's about 12 to 13,000, 32 buildings within about 6 to 7 square blocks. So it's a
Wow.
densely populated area.
Densely populated and underserved in so many ways, and what
Yes.
Ramik is doing is helping to fill that gap. Let's just talk about physical activity, and then I want to show a really cool video. What kinds of things, physical things? So you talked about fencing and those kinds of things. What do you do to encourage them?
We give them stipends. We take them on
Really?
field trips. Absolutely. We provide for them in a comprehensive approach. So looking at their needs academically, looking at their needs socially, looking at their familial needs, linking their families to resources that they need in terms of healthcare, in terms of education, in terms of occupation. So really trying the comprehensive approach. In terms of actual physical activity, just this past Saturday, our kids were in Claremont Park. really doing all the mulching and the composting.
Wow, there
and
you
that
go.
doesn't seem like a sport, but it is physical activity and it's an investment.
Absolutely. And it gets them out, and this is your neighborhood.
Yes.
Wow, this is just wonderful. And what that underscores for me, which we know in every Bronx neighborhood, the resources are there. These are solvable problems.
Absolutely.
And I really want to show this video, but Patrick, you mentioned budget. You mentioned the idea of budget. There's a part of me that says, while I realize Directions for Our Youth requires a budget to run the thing, this is not necessarily a budgetary thing. This is like one of these things. Let's figure it out.
You know, you're absolutely right. You know, we use the word kind of collective impact, cross-sector collaboration. It's a lot of in-kind contributions from the partners. It's a lot of volunteer time from the community, both the leaders, the youth, and the youth's parents and families. As you're absolutely right, there's a lot of resources and assets, really human capital there that people are willing to see and improve their community if, you know, just connected.
Let's do the physical thing. I interrupted my train of thought about the physical activity. So there was like the world's greatest strength or Bronxite or something.
Yes.
Tell me what we're about to see here.
So it was a competition to see what neighborhood and what borough could produce the most pull-ups. And it was to
There you
produce
go.
physical activity. So the video I think you're about to show is kids and some adults trying pull-ups. Some for the first time, some it's habitual. Some were able to do more than one, some were only able to do one or two. So it's really about trying new things and staying active.
And again, just reinforcing everything we've been talking about, when you see some of these kids and they can't quite do it to get themselves up, they seem to be having a good time. And you know, this is to show that healthy activities, physical activities can all be fun.
Right.
So here we are, Claremont Healthy Village Initiative, and is this video that's out there about kids doing pull-ups in the Bronx. Let her rip.
So what I decided to do was team up with my friend Mr. Johnson and have a program where we can prove to the world that we're the strongest borough in New York City. What is a way to show your strength is your ability to pull up your own weight, doing a pull-up. The ability to pull up your own weight doesn't matter how big you are, how small you are, that is a way to show that you are strong. So by having as many people as we can do one pull-up and writing it down, we're gonna take it to the Guinness Book of World Records and prove to them that the Bronx is New York's strongest borough.
The Bronx is the world's strongest borough challenge teaches Bronx residents the benefits of staying active and eating healthy as part of the Claremont Healthy Village Initiative. Baron Ambrosia Fit and Fun Club for the Ambassadors of Hope program engages young people in exercise and educational classes, teaching them the importance of staying fit as Bronx residents to do one pull-up each, which you've all done on the mobile pull-up bar with Thomas Johnson. This initiative has engaged over 1,000 people and is leading the way to dubbing the Bronx as the world's strongest borough.
Super John!
right, there you go. The strongest borough. Listen, whatever gets the kids excited, that is most important. Let's talk a little bit about Casita Maria. They provide so many different services for the region, and talk to me about their input. And by the way, I have to say, Ramik is shaking his head yes, and that shows we're not competing, certainly in this part of the Bronx. We need everybody. So talk to me about Casita Maria.
You're absolutely right. They've contributed to our youth programs, our senior programs, so they helped lead the World's Strongest Borough initiative with Baron Ambrosia. They've also had, as a culminating celebration of the event, there's a mural that they helped kind of design and put on CNC. Working with seniors, they also worked to bring in photography class, artwork, the idea being to engage some seniors at the local senior center, and then we supplied some social workers and geriatricians to try and address some mental health or brain health issues, as the executive director there likes to call them.
You know, you're a program analyst, and so facts and figures would somehow be, I guess you would be the one to deal with that. Talk to me about how you're measuring impact. I mean, I said at the outset that you are having impact. You can't run these programs and not have some impact. I guess it all will come back. How does it impact numbers? And I'm going to interject. I was working with some folks in the Bronx on a diabetes project, and I talked with one of your colleagues at the Bronx Care Health System, and he was telling me about, I forget what the numbers was, like thousands of people on a list who were missing appointments for diabetes. That seems like an impossible task. Yeah. Talk to me about kind of managing it from a healthcare system perspective.
Yeah, so here again, we rely on our partners. So what we try to do is look at engagement levels at the different activities. We do actually focus groups and street intercept types of surveys to evaluate and ask people, do they feel like there's opportunities for youth? Do they feel like people have a chance to eat healthy? And some of the initial survey results have been very positive, actually, with nearly 40% of people being surveyed saying they feel like in the past 2 years there are more youth opportunities. Wow. There are opportunities to eat healthy. So we do street intercepts. We try and do like the old knowledge, attitude, behaviors. We see if people are kind of getting different impressions of what's going on. And then we ask, well, are you eating healthier? We also look at the local bodegas and see who's offering fruits, vegetables, salad bars, and some of the bodegas around Claremont.
And you actually go in and talk to the owners and say, hey, maybe you could do a little better, or a community wants this?
So with actually the youth, again, we've been implementing Shop Healthy, which is...
Bronx kids, watch out for Bronx kids.
They're
don't
sharp.
Say no.
No.
I've been around a long time, don't say no. Go ahead.
It's in partnership with the Department of Health. They have a Shop Healthy initiative, which goes in and tracks and works with bodega owners, to place water at eye level instead of soda, to see if there's fresh fruits and vegetables available. And through this, they're actually available for, I think, a certificate or a proclamation or recognition for these types of things.
What about from, I almost said Bronx, Lebanon, from the Bronx Care Health System, from Bronx Care, are they tracking numbers? Do we see, or is it too soon to really look at diabetes and heart disease and see an impact?
So we receive funding from the Robert Wood Johnson Foundation to work in partnership with the New York Academy of Medicine and Health First. Health First is a very important partner to CHVI too, to take a longitudinal look at
so
these types of things. So I was right about
the number of partners.
Yeah, it just
doesn't
keeps
matter.
growing.
You want to help? Yes, please.
Exactly. So we it's been a 2-year funding period. It's wrapping up actually this fall. So we haven't gotten any data yet, but we're very optimistic. Things that we're looking at include claims data as well as some health outcome data.
Ramik, here's maybe the toughest question I could ask. So let's say we increase the budget a little bit, or more than a little bit. What kinds of things do you realistically see yourself putting in? Is it infrastructure? It is more programmatic material? I mean, what is it that you would like to see yourself? And believe me, I wish I could hand you a check and write it, but I don't have that.
Why not? Do it.
Not yet.
But talk to me about the kinds of directions for our youth that you want to take this?
Yeah, so it's both. You have to burn the candle on both ends, right? And so it's looking at capacity, doing more strategic planning, looking at the whole aspect of what we're trying to do, but also the programmatic part of it, supporting more kids with stipends, really bringing in more people to do the work, activity specialists, experts that can help train the kids on how to be more of who they're going to be given the opportunity. The other part to it, as a youth development organization, we're tasked with developing youth. And so our aspiration is for our kids to have post-secondary options. So giving them the tools that they need to do that. Tutors, support specialists, social workers, those individuals that could expose them to collegiate activities and opportunities. So yes, strategic planning is a big part of what we need to do and want to do. And if given a check, we would do that. But we'd also look at the programmatic part of it, because that's what produces what we saw in the video, right? Those, each time a young kid was being pulled up or helped up, there was an adult there supporting them. So we need to be able to bring more of those folks in.
In terms of the attitude of the kids are happy? They love doing this?
Yeah, I mean, I think it's a misnomer that people in poverty are unhappy, right? I think when you expose them to something new, they're really given that opportunity to latch on to it.
Directions for our youth, look them up, check them out, make a donation, participate, volunteer, do all those things.
Yes.
Patrick, similar question for you, and in a way, maybe it's not really funding, you just need more partners and people willing to help, right? Am I getting that right?
No, I think that's absolutely true, and I think it's also, the willingness to collaborate. We want the partners. There are a lot of resources. There's a lot of, again, people that want to make a difference. So being open to collaboration has made a huge difference in Claremont, and it's something that we hope continues.
How do they get to you, or what do we do?
So we have an Instagram page where we post some information. It's CHVI-BX.
Right, that's Claremont Healthy Village Initiative,
Bronx. Yes, and you can email me. We do have a page on our department website as well.
Very, very good.
Yes.
The app.
And yes, EOC.
There's an app?
There is an app.
Yeah, there's an app in development being rolled out.
Or reach out to us and we'll make the connection
Yes,
for you.
please do.
We certainly want people to participate. Thank you for doing great work. And I will tell you this, I am always sensitive to the fact that if you go to some other neighborhoods north and west of the city, for example, people take these things for granted. We have sucked the resources out of so many of our communities, and here's a way of us putting the stake in the ground and saying we're going to take care of it ourselves. Patrick Maceo, thank you so much for doing great work. Ramik Williams, thank you for doing great work. And if you, my friends, have further questions or comments on anything you heard on tonight's show or anything going on in the Bronx, send us an email at bronxtalk@bronxnet.org. You can tweet us at BronxTalk, or you post them on our Facebook page, and we'll read them on the air during a future edition of the program. You can check out our archives at bronxnet.org. You'll find Bronx Talk by following the watch menu on the new BronxNet website. We thank our great producer, Helen Greenberg. Our director is William Guzman. We really thank them because they're really doing it. And we'll see you next week.